Welcome to today's episode of Optimal Bone Health with Dr. Doug. Today I want to talk about one of my favorite bone turnover biomarkers. So this is a biomarker that you can look at in blood, and the P1NP, which is what we're going to talk about today, measures osteoblast activity. So the osteoblasts are the cells that make bone. We want to know what they're doing. We can actually look at this in blood. So stick around. I'm going to talk about several different things that will increase P1NP based off of research. And stick around till the end because I have a free offer I want to tell you about that I'm super excited about. Okay, so why do we want to increase P1NP? Well, like I said, P1NP is the measure of osteoblast activity. If osteoblasts aren't working, we're not making bone. If we want to make bone, if we want to reverse osteoporosis, we need osteoblasts to actually work. And again, we can measure that in blood. So this is something that we can use in between imaging studies, in between DEXA scans to make sure that what we're doing is heading us in the right direction. So before we get into the research of things that I want to talk about today, I actually just want to mention that if you want your P1NP to go up, if you want your osteoblast to work, the first thing you should do is to avoid taking the anti-resorptive drugs. So this is a controversial statement, but the drugs like the bisphosphonates, the Reclass, the Fosamax, and even Prolia, all of these drugs that are anti-resorptive by nature are going to reduce P1NP. And you might be confused by that statement because these drugs are designed to work mostly on osteoclasts, and that's true. But after having measured this data for years now in patients with osteoporosis, when you compare what's happening to P1NP and CTX, in general, what we find is that they move together. And that kind of makes sense. Bone metabolism is a linked thing. So if you crush osteoclasts, the cells that break down bone, with a bisphosphonate or Prolia, what you're going to find is that the osteoblasts actually slow down the function as well. So you reduce osteoclast function, you reduce osteoblast function. So the cells that are poisoned by the bisphosphonates will then have an impact on the cells that build bone. So I just saw a patient example of this yesterday. So we had a patient who was even a year and a half out from a reclassed infusion, and her CTX or bone breakdown biomarker was super low, as you would expect for somebody on a drug like that. But her P1NP was also very low. And we see this all the time where she's very concerned about not building bone and not making bone, and you can't because your osteoblasts aren't doing any good. So the bone mineral density will go up because you're not breaking down bone, but you're also not building good bone. And that's the issue with these drugs. Now, like all drugs, there is a time and a place. But for most women, I think that they're overutilized. So that's number one or number zero of increasing P1NP is don't take a bisphosphonate or Prolia. Okay, now let's get into the research on the things that we can do to increase P1NP naturally, because that's actually what I wanted to talk about today. So most of the studies actually that I found were based on exercise. So if you look at exercise research, there are some very specific things in exercise that we can talk about and we can look at that will increase P1NP, but it's not all exercise, and this is really important. So this first study I want to look at is from June of this year in 2023. And there were 4 groups in this study. And so they were looking at runners, so runners pay attention. They were looking at runners, and they had runners that ran alone, runners that ran and did resistance training. They had people that didn't run and did resistance training, and then people that didn't run and didn't do resistance training. So they did nothing. And the study was 16 weeks long. The resistance training specifically that they did were squats and deadlifts, and that's it. So they would do squats and deadlifts. They would do it twice a week, and they would do 5 sets of 5 reps at 60 to 85% of 1 rep max. Now, if you are not a squatter or a deadlifter, please don't run out and just start doing this. This has to be done with the right form to avoid injury. But 2 exercises, 5 reps, 5 sets, twice a week, all right? Now, the running protocol actually wasn't described, so I don't know how far they ran, how often they ran. They just were runners, which is kind of what a lot of runners do. They just run, which is okay. All right, so then they measured bone mineral density, which 16 weeks is a pretty short interval between DEXAs, but okay. They measured bone mineral density. They measured P1NP, which is the breakdown marker, the buildup marker that we're looking at. And then they also measured NTX, not CTX, and NTX is a urine-based breakdown marker that's similar to CTX. It measures a similar thing, but it measures it in urine, not in blood. So let's talk about bone mineral density first. So what's interesting here is that bone mineral density actually did go up. Now, it only went up between 1 and 2%, so 1.3 to 1.4% in the whole body, not specifically spine and hip. And that is probably within the margin of error of a DEXA. So it's hard to really know what to make of that. And honestly, in 16 weeks, I wouldn't really expect to see much of a change anyway, but certainly a trend in the right direction. So that's cool. And then we looked at most specifically the P1NP. So this is really what I want to talk about here. So in the resistance training runners, so runners that were also doing resistance training, their P1NP went up by 30%. In the non-running resistance trainers, so these are people that were doing the weightlifting but not running, you saw a similar 30% increase in P1NP. So resistance training in both of those groups had the P1NP go up by 30%. Cool. In the runners alone, they saw a drop of 15%. And this is really important because people ask about the impact of running and is running good for bone density? And clearly we can see in the research that running is not good for bone density, even though there is impact, but it's not enough impact to grow bone. And if you're running long distances, the potential stress, your body's response to running long distances is to reduce bone density because it just doesn't need the bone density. It doesn't want the weight. And so this is a great example. We see P1NP drop in runners that are running alone because there's not enough stress to tell the body to build bone. In the controls that weren't running and weren't doing resistance training, we saw no change, which is what you would expect to see if you're not doing anything. In this age group, you could expect to see nothing, and over 16 weeks is a short time frame. Over the long term, as we get older, though, we'll see that control group start to lose bone. And P1NP, my guess, would drop, but it would take a long time. Now, what about the NTX? Well, I mentioned NTX is the bone breakdown biomarker, and this isn't really about NTX, but we did have it, so I just want to mention it. And it did go up in the resistance training group. And I think what's interesting about that is that when we look at P1NP going up, typically what we're seeing now in our patients is we're seeing that CTX, or in this case NTX, will go up as well. But what we want to see is that the P1NP goes up enough that the increase in bone breakdown is outpaced by the increase in bone building. And that's really important because if you only do one side of the equation like a drug does, then the bone metabolism gets broken. We always want it to go together. It's not commonly that they're going to move separate, although I've seen it. But I'm not surprised that NTX went up. Now, here's what's interesting about this. NTX, the breakdown marker, went up more in the runners than it did in the non-runners. So I think there's this potential impact of the running causing more bone breakdown than people that weren't running. Now, it wasn't statistically significant between the two, but still interesting to see that trend. Just goes to show for me that if you want to use exercise to increase bone mass, you really need to focus on the resistance training. Other things have value, but resistance training, when it comes to exercise for bone health, excluding other things like impact, osteogenic loading, etc., when it just comes to the different forms of exercise, resistance versus aerobic, resistance training is king. All right, so the second study I want to talk about here is a study that looked at kind of several different forms of exercise, but they also looked at performance. And what's interesting about this study from 2022, it was a kind of smaller but randomized control trial, and they were looking at performance pre-exercise, and then we're looking at blood turnover markers after, but also before. One of the things that's really interesting is that they found that people that had better performance, meaning that people that were more fit, had a higher P1NP just simply across the board. So one of the takeaways from this study is simply that the more fit you are, the more likely you are to have osteoblast function that's higher, which is kind of cool. Now, they didn't do this study for long enough. They didn't look at bone mineral density or changes in DEXA or anything, but just simply saying the more fit you are, the more active you are, the more likely you are to see P1NP at elevated levels in blood compared to people that aren't as fit and aren't able to perform quite as well. Okay, so to keep you from getting bored, I want to skip over several studies. I'm going to skip to this third study, which really looks at impact, which is the most important thing I want to talk about out of this study. But there were several studies that also looked at different forms of aerobic exercise versus resistance training. And what we see consistently with these studies that look at both CTX and P1NP is that CTX will drop with most forms of exercise, potentially except for aerobic exercise like running, as I mentioned earlier. But P1NP either doesn't go anywhere or it goes up. So consistently, we're seeing that move in the right direction with exercise as a therapeutic for bone density. Now, what's interesting, though, is that we don't see it as an isolated intervention to have a tremendous impact on bone density over time. But I think it's mostly because the studies that have been done have not been aggressive enough, and we're not seeing significant resistance training in conjunction with impact like we are in other studies like the Liftmore trial, which has been done previously, but still relatively short interventions. I think if we follow those over a long period of time, we would see more benefit for bone mineral density and potentially fracture risk. But of course, we haven't seen that because the studies just simply aren't long enough. But this third study I want to talk about from 2020, they talk about all kinds of resistance training and aerobic exercise. But what was really cool about this study is they also looked at a very short intervention and they looked at impact. And this they looked at very specifically in this. And what was cool about this is that they looked at P1NP after a short intervention of impact. So meaning that a relatively short study, and they looked at different types of jumping. And again, this is another thing, you know, if you're not able to jump off of something and you don't know how to do it well, please don't do it without somebody guiding you and what some of these things mean. But they describe these things as diagonal drop jump and a drop jump and a counter movement jump. And so they had all these different ways of creating impact. And what they saw is a between 7 and 10% increase in P1NP, again, over a short interval. So impact really has the ability to increase bone. And this makes sense because if you think about the discussions I've had around osteogenic loading and what really OsteoStrong and biodensity are doing for the bone is basically creating impact in a controlled manner. Because we've known for a long time that people that jump off stuff, like gymnasts, they have better bone density than do people that don't. So this is just a way to mimic that. Osteogenic loading through those devices is a way to mimic that. You can do it in exercise, but with impact comes risk. And so you just have to be careful there and make sure that you're doing this appropriately. We're actually, at this point in time, creating an impact protocol in our program to help people that are able to do that in conjunction with resistance training, because again, we're going to do this over a longer period of time and follow it to see if we can see an improvement in bone mineral density and reduce fracture risk. All right, so before we get into the next couple of topics, which includes supplements, which includes a couple of drug things to chat about and hormones, I just want to take a quick moment to say thank you for watching. And if you haven't already, please click the subscribe button. The benefit for me is that it helps me to help other people. For other people who are looking for bone health content, if you click the subscribe button, it promotes YouTube to promote us. So I appreciate you doing that so you can help me serve my mission. If you haven't already and you want to watch how we put all of this information together in one place, come visit us in our masterclass. We run about every 2 to 3 weeks. It's totally free. I put together an updated plan based off of all the research that we're doing into one place and walk through it with everybody that shows up. Then we also have the opportunity for Q&A. So if you haven't done that yet, strongly encourage you to do that. All right, let's get back to what we're talking about. Okay, so what about supplements? Can any supplements specifically increase P1NP? And the answer is yeah, some can. Although what was interesting for me is that these aren't supplements that we're actually currently using. And I'll go through each one. There's only a couple. And it's interesting that the research is on them and not others that are more common. But either way, let's just run through them. So the first one that came up in our research was actually the black currant. And I'm not even sure if I'm saying that right. But basically currant or currant, C-U-R-R-A-N-T-S. These are little berries, and there's actually a company in California called Just the Berries Research that is doing all this research on these little berries. This supplement is available commercially, but only in a seed oil, so in the kind of the oil or an extract, and I don't know that that's going to actually do the same thing. So this is not something that we're going to incorporate, but it was kind of cool to see that there are potentially some supplements, and it increased P1NP significantly. So it actually doubled P1NP. In a small increase in CTX. So it looks legit. I just don't think it's available yet. So don't go out and buy black currant oil or extract because I don't know that it's going to do the same thing. The other thing that we found, which was interesting, is French maritime pine bark extract. Now, this is something that I've actually used previously for cholesterol and for reducing oxidative cholesterol. So this is a HealthSpan play. But actually, it was interesting to see that this, in conjunction with P1NP, looking at a relatively short-term study, showed that it did actually increase P1NP. But again, not long enough to look at whether it'll have a significant impact on bone mineral density and fracture risk. Short-term studies, that's kind of what supplement studies generally are. So just kind of cool to think that, yeah, you know, there are some supplements that can do this, but not any of the things that we're currently recommending. There is a product that we may incorporate for some people if they also have issues with cholesterol, because again, we're always trying to improve bone mineral density through the lens of HealthSpan. So if somebody that has cardiovascular risk, maybe we can help reduce oxidative LDL with this product that would potentially then also play on P1NP. So something that we might play with, but probably not going to be one of our primary players. So otherwise, no great supplements that are going to play a huge role in P1NP. This is really going to be driven more by diet, some things I'm going to talk about in a second, but also the exercise that we just talked about. Okay, so what about hormones? Well, there were no specific studies on hormones and P1NP. We know that estrogen will have a tremendous impact on CTX, so it will reduce CTX. I've not seen a study looking at hormone replacement specifically for P1NP and CTX. I am going to talk about next a drug that is an anabolic drug. So this is something that you could almost make a parallel to with using testosterone. But again, testosterone in women, if you've heard me talk about this, is really not studied for anything other than hypoactive sexual dysfunction disorder. And that's about it. And there's a whole lot of reasoning behind that, which I love to talk about, but I'm not going to spend time talking about it now. Just know that I think that it is underutilized and under-discussed for the beneficial role that testosterone can play in women, because testosterone is the primary sex hormone in women, not estrogen, and that's massively misunderstood. But anyway, so this anabolic drug that I want to talk about, we found a study looking at this drug called animerelin. Now, animerelin, I could not find it to be commercially available anywhere. So I'm not saying go out and use this drug. But here's what's interesting about this drug, is that animerelin was used in people that had cancer, for people that were under-muscled and had a hard time gaining weight because they didn't have hunger, because it increases hunger through the ghrelin pathway. So ghrelin is one of those hormones in your stomach that plays with leptin, and you get hunger and satiety signals based off of these hormones. So if you increase ghrelin, like this drug does, it'll increase hunger and it'll increase the amount of food that you eat. What's cool here is that it increased P1NP by 75%. Now, what I like about this study is to say, well, it probably wasn't actually ghrelin in the drug. I can't say this for sure, but it was probably simply the increase in calories and hopefully the increase in protein that these patients started to eat, because they were increasing, and this is in a controlled setting, the food that they were given, the consumption that they were given, and hopefully they were given a good diet, although it's hard to say. But that's generally what we see to go up with eating a good diet and a protein-forward diet and getting adequate nutrients, is we'll see P1NP rise. And so I've not seen a nutrition study on this, but you could take away from this study that these patients were eating more food, their P1NP went up. So when we talk about eating an optimal bone diet, which is going to be a protein-forward from animal sources, potentially with dairy if it can be tolerated, but ultimately with more nutrition, more dense nutrition, and more calories, most of the patients that are doing this are not at risk of weight gain, and they will gain a little bit of weight, but they're going to gain muscle and bone, and that's the point. And we can see P1NP and went up by 75%, and it really didn't change CTX. So that's kind of cool that it's really just pushing on one side of this really hard. We didn't see CTX go down, and I wouldn't expect it to, but we saw P1NP go up, which is what I would want it to do in this case. All right, so what's the takeaway here? Well, the takeaway here is if we want P1NP to go up, what are the things that we need to focus on? So here they are. Resistance training, because we know that that's going to do it. Impact training, if you have the capability of doing it, or osteogenic loading, which we know will do it as well. Testosterone and an optimal bone health diet to help improve muscle mass, to help improve the amount of protein that you're getting and the nutrients that you're getting. So that's going to really push things forward. Supplements, maybe, but I really think we're going to focus on more the hormonal route, the nutrition route, and the training route. And I think those are the biggest players. Now, we know that everything happens in conjunction together. The body is connected. And when I look at all the things that we're recommending that people do, I find that most of them are actually aimed at P1NP, although we will see CTX adjust accordingly as well. It's cool to see more and more of this research using these bone turnover markers, so I'm excited to continue to see all these things come out. So that's all I've got for you today. If you haven't already, please click that subscribe button to help me help other people. And then here is the free thing that I wanted to tell you about that I'm super excited about. Our Bone Foundations course is a course that we created to help people to really reverse bone health issues, improve their osteoporosis, and improve their bone density on their own. And this is something that we used to sell through our practice, and we're actually now giving it away for free. I feel so compelled to help people with this problem that I want to give as much information out as I possibly can. So our Bone Foundations course is now free. With that, you get at least 16 modules, and we're updating them all the time. We have a plan to continue to update everything as we go, as we learn more. A workbook that goes along with it, nutrition guides that go along with it, the ebook. If you haven't already seen our book, it's behind me here on the shelf, The Osteoporosis Breakthrough. You can download that book for free or buy it on Amazon. You get a free month of our HealthSpan Nation along with this as well. So come join the Bone Foundations course. No reason not to go through this. Again, it's absolutely free. The HealthSpan Nation is your opportunity to ask me and my team members in a weekly Zoom questions. We go through questions and chat with people live. We also have a community where everybody can come together and ask each other questions and support each other. It is really, really cool. We're seeing a lot of people getting help through there. So I'm really excited about the HealthSpan Nation, which you get access for free through the Bone Foundations course, or you can do that separately. So come on in, join us in the HealthSpan Nation. I look forward to seeing you in the Bone Foundations course, and I will see you again in another video. Thanks again.